Uh, Let us continue IDA. Here are three very important but very interesting cases. One condition is relative anemia, second is twins, and third is the copper deficiency anemia. That is, of course, in prematurity. Let us think about the twins. When the mother has twins, first and second, the second twins has always problem. The second twins has the weight is less. It's a IUGR baby. Whatever problem, say anemia, second baby. Prone to the infection, septicemia, second baby. So, twins is the important cause of IDA. Let us consider relative anemia. What is relative anemia? I will just explain. This occurs in cases of congenital cyanotic heart diseases. Obviously, when it's a cyanotic heart disease, there will be hypoxia. This hypoxia will stimulate the erythropoiesis. Because of this, the number of RBCs will go on increasing and increasing. But at the same time, the amount of hemoglobin synthesis will not increase. So what ultimately happen? The hemoglobin for that baby, for that age and sex is normal. But as the number of RBCs are increased, that is the condition is polycythemia. This normal amount of hemoglobin is distributed in more number of RBCs, which ultimately causes iron deficiency anemia. This type of anemia, though it's otherwise, if you think logically, is not anemia, but presents as anemia. So it's called as a relative anemia. The third interesting condition, when we say that patient has iron deficiency anemia, what is the treatment? Definitely you will say that, sir, we have to give iron. When iron is given, baby will be okay or the patient will be okay. But here is one condition. There is an iron deficiency anemia, but it is not corrected by giving the iron supplementation. Let us see what is that. It is the particular condition of copper deficiency of prematurity. What is the role of copper deficiency in anemia? Let us see the baby, how it presents. This premature baby presents at around the age of 9 to 11 months. The baby looks very sick, pathetic baby. The baby is irritable. The baby is anemic. The baby is sometimes mentally retarded. Baby is not growing properly. Low weight for that age. Otherwise premature. Again, the baby appears very small. The baby has all the limbs, there is a hypotonia, and there are some skin findings. The skin is underpigmented. The hairs are also, they are not dark black, they are sometimes grey in color. Sometimes you may get the signs of seborrheic dermatitis. When you get these signs in premature baby and anemia, if these signs along with anemia and patient is not responding to your iron therapy, then the first thing you must think that there is a deficiency of the copper. Then let us see what is the role of copper in the anemia. Copper though copper is a trace element. What is total amount of copper in the body? It is just 150 milligram total in the body. 150 milligram. But if it is less, it causes anemia. If it is more, it causes Wilson's disease. Wilson's disease is also called as hepatolenticular disease because the copper is deposited in the brain as well as in the liver. And the diagnostic sign of Wilson's disease is KF ring, which is in the cornea. This is about the copper if it is more, and if it is less, then you get the copper deficiency anemia. The role of copper in the synthesis of hemoglobin, first it acts as a cofactor and it activates the enzyme which helps in the synthesis of the hemoglobin. You got it? For the synthesis, enzyme is required, and that enzyme is stimulated by the cofactor, and that cofactor is copper. That is one. Second, the copper actively takes part in the synthesis of hemoglobin. How? It actually incorporates the iron into the hemoglobin. This is the very second important function of the copper in the synthesis of the hemoglobin. So, when copper is not there, obviously synthesis of hemoglobin will not occur. Let us see what happens to the pathology. When you take the PS obviously it is microcytic and hypochromic iron deficiency anemia. When serum ferritin is seen, it has gone down. When you take total serum iron, that is also the levels are low. But as you are thinking it's a case of probably copper deficiency, then you have to go for the copper estimation in the serum. That again the levels are down. And the important protein which actually carries the copper, that is called as ceruloplasmin. The level of that also has gone down in case of the copper deficiency anemia. Means when you get this, then your diagnosis of copper deficiency in prematurity is confirmed. Again in the X-ray what you get? You get more findings which are related to the bones. You get osteoporosis along with the metaphyseal flaring, cupping, spurs, and very importantly, the case of iron deficiency anemia in prematurity, they have a tendency of pathological fractures. Right? So, here I have written iron deficiency anemia not responding to iron. What is that? That is the copper deficiency anemia of prematurity. Right? We will take the another subject. See, this is very important slide. There are some stages of iron depletion. What is iron depletion? The normal or non-anemic person, before he enters into the phase of anemia, there are stages of depletion of the iron. In other words, what I mean, if the patient is exhibiting some signs of anemia, it is definitely not that the things or depletion of the iron has appeared in few days. Whatever could be the intelligent doctor, he cannot diagnose the case of anemia because the process of anemia has started some weeks or some months ago. And when there are some signs and symptoms of anemia, then and then only the doctor will think about the anemia. In other words, what I mean, the anemia today what you are seeing, that has already taken place. This anemic procedure has already taken place few months back. And now what you are seeing today is the result of what has happened few months back. Let us see what happens. In iron deficiency, definitely the iron is reduced. How it is reduced? In the first phase, the iron is stored in the liver. That stored iron is gradually reduced. And when there is almost no iron stored in the liver, that is called as the stage 1. This happens in the stage 1 where the iron store is completely consumed because there is iron deficiency. Whenever iron is required, that is taken from the storage. And when the storage is completely consumed, that is the stage of iron depletion, and that is first stage. In this stage, there are no signs of anemia. The depletion of iron has already occurred, but no signs of anemia. Second stage is, say, in first stage already whatever storage was there, that has gone. Now, It is the number of ferritin. Now, ferritin, the plasma ferritin or the ion in the form of ferritin, which is moving in the blood, floating in the blood, that also goes down gradually. How it is measured? This blood transferrin is measured by the transferrin saturation. What is saturation? Normal saturation is from 16% to 50%. How it is calculated? There is a very simple formula. Serum total ion divided by TIBC. TIBC means total ion binding capacity. And it is to be multiplied by 100. When something is multiplied by 100, ultimately you get the percentage. That is what? The normal percentage is 16 to 50%. This normal percent that goes down, if you get the percent of transferrin saturation below 15%, then it's a second stage, and in this second stage it is called as the transitional phase of anemia. Why transitional phase? Because the process of anemia has already started, but even second phase also there are no signs of anemia. It just the transformation of a normal patient who was otherwise into an anemic one. That is just transformation. Therefore, it is called as transitional phase of anemia stage 2. Now, the stage 3. What is stage 3? The storage has gone. In transitional phase, again, whatever transferrin was there, which was moving in the blood, floating in the blood, that has also gone. Then what happens? In the third stage, as there is a severe deficiency of ferritin, that is the store ion, as well as the plasma transferrin, that is also gone, then at this stage, what happens? The hemoglobin level goes down for that age and sex. The volume of the RBC, the MCV, that is also goes down. Means what happens to that? The normal RBC volume is 83 cubic micron. The 83 cubic micron volume has reduced to 70 cubic micron. Means there is a drastic change in the volume of the RBC. That is what we say microcytic hypochromic, because the volume of the RBC is contracted, small. Third important change is the erythrocyte contains protoporphyrin. This protoporphyrin plus ion, that is Fe, that forms heme. When protoporphyrin combines with iron, it forms heme. And when iron is not there, the protoporphyrin will be without iron. So its percentage is increasing. So erythrocytic percent of protoporphyrin compound is increased. Hemoglobin and MCV, they are also gone down. These are the three important signs when the signs of anemia, symptoms of anemia, they becomes overt. When they become overt, we say overt sign of anemia in stage 3. Means actually we see the patient of anemia, various signs and symptoms in that case. So that is the presentation of anemia. In other words, what I mean, in case of iron deficiency anemia, though you are looking the patient today as a case of anemia, but the deficiency of the iron, rather the process of formation of anemic patient has started few months back, right?